So thank you, Richa and Alok and all other, Madam Ghoshal, Chairperson, for this wonderful opportunity on the occasion of World TB Day. So it's a basically dream of our Prime Minister to end TB in this country by 2025. And as Professor Bera had mentioned, that it's a dream, or it's a very ambitious dream, which is the target 5 years ahead of the international targets for ending TB. So, coming to the topic, if you realize in last 73 years, if you see the first Prime Minister to the latest Prime Minister, the tuberculosis has been concerned for the both Prime Ministers. The Pandit Jawaharlal Nehru, the first Prime Minister of India, said about tuberculosis that whether we ourselves have escaped from the scourge of tuberculosis or not, there is probably hardly a family which has not had to do something with this deadly disease. And why, you know? Because his wife Kamala Nehru died of tuberculosis. And currently the Narendra Modi also on Delhi and TB Summit, it was a very important landmark in the history of tuberculosis for our country. That is 13th March 2018. And I think some of us were present in that meeting. I and Professor Bera was there. And then Honorable Prime Minister Sri Narendra Modi, in presence of Director General of WHO, declared this ambitious target of end TB by 2025. It's not a simple target. And you know, another historical man in the tuberculosis, that is Robert Koch, who got Nobel Prize in 1905 for the discovery of causative organism of tuberculosis, which he declared on 24th March 1882. That's why every 24th March is being celebrated as World TB Day. You know that WHO declared tuberculosis as a global emergency in 1993. My dear friend, 2 years back, when the COVID came, WHO declared COVID as a global health emergency. And can you imagine, for a disease, the COVID, which we have emergency around 2 years, that's all. But for tuberculosis, this global health emergency continued for last 29 years. I think in the history of WHO, in the history of disease in the world, no disease has got such priority that it is a global health emergency for last 29 years. So, if you see the evolution of TB control, TB elimination in this country, our National Tuberculosis Control Program started in 1962 and went on various changes, and latest change is converting its name from RNTCP to NTEP, that is National Tuberculosis Elimination Program. And of course, the historical declaration of end TB by 2025 on 13th March 2008 by Honorable Prime Minister. So this is the historical picture of that day, end TB by 2025. And of course, what is the vision, goal, targets and milestone for this? The Sustainable Development Goal internationally set for 2030, they are the same goal which we want to achieve by 2025. What we want a zero TB deaths, zero TB disease and zero TB suffering. This is the whole structure, this is the national structure for which we want to achieve this national target of end TB by 2025. This percolates from the Ministry of Health and Family Welfare, under which works the Central TB Division. And in each state, there is a state TB cell. During inauguration, you see the state TB officer, Dr. Santosh Gupta. So in Uttar Pradesh also, we have UP state TB cell, of course, controlled by state TB officer. And then we have certain national committees at national level, certain national institute, for example, National Institute of Tuberculosis and Respiratory Disease at Delhi, and NIRT, and so many other national institutes. And then we have the state training demonstration center at every state. In UP, we have at Agra, and a very important program that is called Difficult to TB program. That is running by State TB Demonstration Center, Agra. And then in each district, we have district TB center. UP has got 75 districts and we have 75 district TB centers. In India, all of these 70 districts, we have the district TB center. Then we have TB units around 6,532 TB units are working, and then we have the TB diagnostic centers, more than 20,000 TB diagnostic centers in this country, and a lot of peripheral health institutions also part or parcel of this program. So this infrastructure and network, really we want to end TB by 2025. I will not go into the details of TB burden, Professor Behra has elaborated already. So what are the challenges for NTB 25? Roughly, it's not a simple mission. It's a very difficult mission. So what are the challenges we have? And I've tried to nutshell into a table the 10-point challenges. And the most important challenges before the tuberculosis is the malnutrition. Whether it's a pediatric TB or adult TB, and one study has shown that majority of the TB patients, they have BMI less than 16 or even 17. So malnutrition is very important. So really want to eradicate, or we really want to eliminate TB by 2025, we have to fight against malnutrition. The second is the population and overcrowding. We know that tuberculosis is more prevalent in the overcrowding areas, and that's why we have to decongest the slum areas of the cities. The 24% of the city's population in this country is the slum area. And we have to target, we have to do a lot of active case finding in these areas, and we have to diagnose and treat cases in these in these slum areas and the congested areas, overcrowding areas. Because in overcrowding, transmission is more rampant. Then of course, certain immunosuppressive diseases, and of course, diabetes is very fulminant in this country. So we have to, of course, if we really want to eliminate TB in this, we have to control diabetes. So it's not only pulmonologist, every physician, every doctor has to be involved, because we are not treating the diabetes. So among all physicians have to be requested that really, if we want to achieve the target of TB elimination by 2025, we have to control all the diabetics patients' diabetes. Similarly, we have to augment the health infrastructure, because health infrastructure, especially in periphery, in rural areas, remote areas, hilly areas, tribal areas, this health infrastructure is very poor, and we have to improve it. Smoking is and other addictions. There are so many addictions in this country, and we have to control, we have to target these. Until we control these addictions, we can't think of even eliminating TB. So only TB program, only Prime Minister Modi, only Dr. Behra, Dr. Alok Nath, or Dr. Anshad, or Dr. Suryakant, Richa Mishra, Ujjwala Ghoshal cannot, or Jia Hashim, whosoever it is, they cannot alone, or they cannot in small groups, they cannot control tuberculosis or eliminate tuberculosis. Everybody has to be involved. Air pollution and biomass fuel. Thanks to Prime Minister for starting this Ujjwala Yojana, and more than 8 crore families, poor families, they have been given free LPG gas connection, and that's why now country is heading toward the clean fuel for cooking, and that's why of course the problem of biomass fuel is going down, but is still out of the 30 most polluted cities in the world, 22 are from India, and we are facing a lot of challenges from air pollution. So we have to control this target, to control the air pollution also, if we really want to achieve the target of NTB by 2025. Similarly, poor sanitation and poor ventilation. You know, it is not Dr. Suryakant who is saying, it is the Toman, small book by Toman. This says the 5 minutes direct exposure of sunlight to any mycobacterium tuberculosis kills all TB bacteria. So all housing, all areas with the poor ventilation and poor sunlight exposure, they are highly susceptible for tuberculosis. And we have to make the houses policy like this, that all houses, whether they are flats or they are individual houses, they should be properly ventilated and they should have proper sunlight exposure. Similarly, for females, very important aspect, early pregnancy, repeated pregnancy at short intervals, they are making the young females very immunocompromised, and they are more susceptible for tuberculosis, and overall stress in the society. So I think psychiatrists also in this country, they have to be involved for the target of elimination of TB in this country, because stress itself is a immunocompromised state, and people suffering from stress, they are more vulnerable for developing tuberculosis. And COVID-19 in last 2 years, this has given a setback to NTB-TB initiative. We know everything. So these are the 10-point challenges which we have. Still we have way forward. So I will not go into we have so many publications, review article that malnutrition and there is a direct link between malnutrition and immunocompromised state similarly the COVID impact. If you see the worldwide deaths for the COVID, it was 1.59 million deaths in 2018, which have increased to 1.8 million in 2020. So this is the impact of COVID-19. And India is lucky that, of course, we probably in majority of areas and in larger perspective, we have got rid of COVID-19. And that's why you can go through this our article that impact of COVID-19 on tuberculosis, challenges and opportunities also. So we can utilize this COVID-19 as opportunity also. We have learned so many things. What is the TB elimination? Actually, we are talking of target of TB elimination. What exactly means? What do you mean that there should be no TB case after 2025? No. What WHO definition of TB elimination means that reducing the cases of TB to less than 1 per million population. 10 लाख की population में जब एक या एक से कम TB का मरीज हमारे देश में होगा, तो हम कहेंगे हमने TB elimination का target प्राप्त कर लिया है. So what is the way forward? So we should not be hopeless this 2 years of due to 2 years of loss of COVID, because of COVID-19. We should have some hope and we have the way forward. What is this? Number one, again I have shown you the 10 challenges. Now we have the 10 ways of forward. What is the way forward? First is a strict and intense TB notification. Actually, TB was declared as a notifiable disease in 2012. But till 2018, nobody was aware of this TB notification. Even medical fraternity was not aware of. Now we have to intensify the notification. In 2018, this TB notification has been intensified, augmented, and now under the section of IPC 269 and 270, if a doctor, pathologist, microbiologist, or a pharmacy person not doing notification, because 3-tier notification is there. A person who is making the diagnosis of tuberculosis has to notify. A doctor who is prescribing the treatment has to notify TB, and a pharmacist who is dispensing the medicine of TB has to notify. So 3-tier notification, and everybody who fails to notify at its own level, he can be sent to a jail for 6 months or 2 years or a fine or both. Till date, nobody has been sent to jail in this country, but this message should be percolated to everybody that it's a notifiable disease and you can be sent to jail for 6 months or 2 years or fine or both. So TB notification should be on priority basis, but this message has to be percolated among the fraternity and to the society. This is the format of TB notification. I will not, this is for the doctor, this is for the diagnosis, this is for pharmacy. And second point is, which of course have been part of this program also, the expansion of Nikshay Poshan Yojana and a strategy to involve NGOs. Governor of UP has taken a lead in this regard, Srimati Anandiben Patel ji, who when joined the UP as a governor has given a call for adoption of children suffering from TB. And today, I think I must congratulate to the SGPGI director, CMS, MS, and Richa Mishra, Alok Nath, and everybody, Ujjwala Ghoshal ma'am, everybody, whosoever part and parcel of this program, that they have already make a part of this program, the adoption program. And she has given a call for the lot of universities, institute, NGOs, has become forward to, of course, support and augment the nutritional scheme. I think this initiative started by the governor should be a national program. And I will request the Dr. Behera to carry forward this message at national level, that we can adopt same type of program at national level. Until date, 38,000 children have been adopted in the Uttar Pradesh. This is the Nikshay Poshan Yojana, everybody knows. And still the news is not in the society, in the media, in the community. So I think we have to sensitize the people that you get registered, you get notified, and you will get the benefit of 500 rupees per month notification support, nutritional support by DBT. The third is the involvement of private sectors. because most of the patients, they are going still in private sector also. So without involving the private sector, you cannot eliminate TB, and we have to expand our program. And there are a lot of incentive also for the private sectors. For example, a private doctor will get 1,000 rupees of incentive, not the government doctors. I and Dr. Alok Nath are not entitled to get the incentive. So everybody should know that we have to sensitize the private doctors. The private doctors will get the 1,000 rupees at the completion of treatment once it is notified and patient got full treatment. And then at the end of completion of treatment, the doctor, of course, that index doctor will get the 1,000 rupees as an incentive. And similarly for the previously treated cases, 1,500 rupees, and drug resistance cases, 5,000 rupees. And even the incentive for the informant, the person who carries the TB presenting case to the health facility, he will also get some incentive. The fourth point is for the way forward is the sensitization of healthcare workers toward the social welfare scheme. There are a lot of schemes, even the nutrition support program, the community is not aware of. So I think we have to sensitize the community and everybody for this healthcare worker, for this community, for the various social welfare scheme, including the nutritional support program. And everybody should know that at the government centers, the free medication is available, free investigation is available, and nutritional support program 500 rupees per month is also available. The fifth point of way forward is intensive use of new technology. I think we are using new technology, and this is the high time that we should use like 99 dots, like this MARM device, like the mobile TB diagnosis in the remote areas and in the like slum areas and the travel areas. The government has already started this facility of mobile diagnostic van and treatment van, and then Health Minister Dr. Harshvardhan inaugurated in 2019. I think this is going on. UP is also utilizing the facility of this. Everybody should utilize. And then like COVID Arogya Setu, there is a TB Arogya Sathi app also, and we should utilize this. Similarly, the Eco Digital India, Eco Platform, and King George Medical University and other centers are also having Eco Platform for advocacy, for research, training, sensitization, and so many other programs. And then, of course, for monitoring also, we have various kind of technology, and we should use this. After this, the use adversity as opportunity. The COVID has given, I would say, a lot of things, and we should not forget that same kind of practices can also check the tuberculosis also. For example, mask, very effective. Physical distancing, hand wash, cough etiquette, using pulse oximeter, adequate nutrition by healthy diet, and awareness of immunity. These are the things which we have learned during COVID times, and we should continue to learn. We should continue to propagate all these in favor of TB elimination. And that's why first time I said that use these things in favor of TB elimination also. So the Deccan Herald, this published my interview. Later on, even my friend Dr. Sanjeev Mehta from Mumbai, he said, send that mask for COVID may end up eliminating TB by 2025 in times of India. And similarly in Hindi, Dainik Jagran, I gave the interview, Lagaye mask nahi, Corona sang TB ko maat. So such practices should be disseminated and continued. Convert TB elimination program into a mass involvement. I said only Prime Minister won't be able to achieve End 2025 program. Everybody has to be involved. So from Pradhan to Pradhan Mantri, every public representative should be involved. Everybody to be involved, making a mass movement. And even IMA has been involved in a lot of activities doing IMA. And we did a press conference in Lucknow a few years back. And this, the brand ambassador program. We have a national brand ambassador for TB elimination program, Amitabh Bachchan, since 2015. We need more TB brand ambassadors. So I think we need more ambassadors for making TB free India. And even a patients who has been cured of TB, this can be made as TB brand ambassador or TB champion for propagating that मैंने TB से लड़ाई जीत ली है, आप भी TB लड़ाई जीत सकते हैं. And 8th point is intensive involvement of district health society. Only district TB officer cannot eliminate TB from district until you involve the whole district health. So I might again request for Dr. Behra and other national leaders that this should be the part of, because district TB officer is not having any command over the health infrastructure of the district. So once district magistrate and CMO should also be involved actively in this program, and then only we can achieve the target of. And then of course the involvement of medical college is very important part, and we have more than 600 medical colleges in this country, and every medical college should be given the responsibility of making TB free district in which that medical college is situated. So we have already started this program of making Lucknow TB free. So we have adopted a slum area, rural, first UP rural village we have adopted for making TB free, and we have adopted first slum area in Uttar Pradesh in 2019, and a lot of public awareness. This is also our moral responsibility, not only professional but moral responsibility, and of course a lot of articles for sensitizing the people. So I'm doing this. I think a request to everybody that we should continue this. This is the book in Hindi, my book in TB Mukt Bharat. And in a nutshell, I would say that although the task is very difficult, but we should percolate this message that tuberculosis is a preventable and curable disease, and everybody should join hands for making India TB free by 2025 and making a dream come true of the Prime Minister Narendra Modi. Thank you very much for this wonderful opportunity.